starting with the musculocutaneous nerve, as it's one of the easier nerves to understand. Okay, as for this nerve, okay, you need to understand first of all the direction, right? How does it move? So we need to say, first of all, it starts at the lateral cord. Yani we have the three cords, as we know, the lateral, posterior, medial, and from your study of the brachial plexus, you know that the lateral cord gives out the musculocutaneous and part of the median nerve. We're going to focus about the musculocutaneous, and simply the musculocutaneous that starts off from the lateral cord will then move inferior to the border of the pectoralis minor. So if we look down at this picture, which we will be looking at a lot of the times, you see this bone right here. This is the coracoid process, صح ولا لا? The one that comes out of the scapula. These two lines that I've drawn here are kind of like a representation of the borders of the pectoralis minor. If you look down here, can you see this line right here? This is the representation of the inferior border of the pectoralis minor muscle. So this is where the musculocutaneous nerve is. So it starts off at the inferior border of the pectoralis minor muscle. Okay, so this is the inferior border, and that's where it starts off. And then it pierces. This is one of the most major things it does actually. It pierces the coracobrachialis muscle. So whenever you look at a specimen, you need to see if this nerve pierces the coracobrachialis muscle, which we know, which is this muscle that goes from the coracoid to the medial surface of the humerus, in the middle. That's where it inserts. That must be the musculocutaneous nerve. After that, it moves from the medial side of the arm to the lateral side. This, guys, can you see this whole area? This is the medial side of the arm, and this whole thing is the lateral side of the arm. So this nerve, as you can see right here, the one in the middle, is moving from the medial side, from this point, to that point. Okay, and the reason it does that is because it's gonna end as what nerve? What's the name of the last? What's the last nerve that it's gonna end as? It's called the lateral cutaneous nerve. It's going to end as the lateral cutaneous nerve. It has to move from the medial side and go towards the lateral side to give out this nerve that we know and we're going to talk about in a bit. But for it to also give this nerve, okay, first of all, the name of the nerve is lateral. معناها it has to move to the lateral side, from the medial side to the lateral side. Also, the other name of it is cutaneous. That means it's a sensory nerve. Also, cutaneous means skin. So for skin, again, the nerve started at the muscles, right? So it has no connection to the skin. For it to go to the skin, it has to pierce the deep fascia. Because again, if you look at the picture, the muscles and the skin are separated by a fascia. For the musculocutaneous nerve to go from the muscle area to the skin, it has to pierce that fascia, okay? So it pierces the coracobrachialis, and then it runs from the medial side to the lateral side. But as it runs there, okay, we need to understand something else as well, and it is that this muscle that it runs over is the brachialis muscle. So simply, it runs through both the brachialis and the biceps. Again, the brachialis muscle and the biceps are over each other. They're on top of each other, brachialis being under the biceps. The musculocutaneous runs through them and diagonally as it goes from the medial side to the lateral side. And then finally, again, it pierces the fascia, the deep fascia, and then finally it gives out that branch, as we said, the lateral cutaneous nerve of the forearm. So, quick recap, it starts from the lateral cord, and then the branch is given off at the inferior border of the pectoralis minor muscle, and then it pierces, it pierces the coracobrachialis muscle, and then it goes in between the brachialis and the biceps muscle, and then finally it runs laterally, which then it pierces the deep fascia to become the lateral cutaneous nerve of the forearm, and that is for the musculocutaneous nerve.